Muted.
This is Tina Reynolds. I am the Health Policy Director here at Michigan Environmental Council, and we're going to start with our Lead Education Day training webinar. Thanks for all of you who are sharing some of your lunch hour with us today. This will also be recorded, and so we're hoping that most all of our attendees will be able to listen. Whether you plan to attend our Lead Education Day next Wednesday or not, this is a really valuable webinar to kind of give you a Lead 101. There's been some new facts and new studies that are out we're going to share with you. We hope to accomplish on this webinar letting you know a little bit more about MIALSH, the coalition, who we are. We also are going to run through our Lead Education Day format so you know what to expect for the day. We can hit the ground running on Wednesday. We're going to talk about how you make the most of your legislative meetings, including protocols and how to meet with lawmakers and get your point across. We also will be running through a real-life scenario in Michigan, how do you get your child tested, what do those test results mean, walking you through lead inspection, risk assessment, and any services that the state may offer as well. So a real-life example of what lead poisoning looks like here in Michigan. And we'll have a lot of time at the end for question and answers for folks as well. And speaking of question and answers, we will be accepting typed questions throughout the webinar. You should see a question box, so please, if you have any questions or concerns you want for us, please type those in, and we will go through them at the end. Also wanted to let folks know, unless you're a presenter, you're in listen-only mode, but if you want to mute yourself, that would be wonderful as well. So first, I wanted to introduce today's presenters so you can see who you're speaking with. Bree Anderson is Associate Director for the Michigan Council for Maternal and Child Health. Again, I'm Tina Reynolds, and I am the Coalition Manager for Michigan Alliance for Lead Safe Homes. And we also have Paul Hahn, who is with the Healthy Homes Coalition of West Michigan. So these are all really active MIALSH participants, and it helps show our statewide diversity and our interests. So the first slide is, what is the Michigan Alliance for Lead Safe Homes? And it is our Lead Education Day. It's our 5th annual Lead Education Day. And you may or may not know, but there was a lead commission in statute under former Governor Granholm that ended in 2010. And this commission worked for close to a decade. It was a very comprehensive commission involving virtually every state agency and interest group working on lead poisoning to come up with comprehensive policies to end lead poisoning in Michigan. Well, the state lead commission was abolished and kind of ended by statute in 2010. But of course, as we know today, there's still a lot of children in the state that are lead poisoned. So there was a strong contingent of folks who wanted to continue the work to end lead poisoning in Michigan with a particular eye on funding to come up with adequate resources to be able to get programs in place for our children. And so this group helped form the Michigan Alliance for Lead Safe Homes, and we are continuing to grow even today. We are a statewide coalition. We have health, housing, environmental, child advocate, health and wellness. We have health departments on our coalition, a really good variety of people working to end lead poisoning in the state. MIALSH works on the state and local level. We help secure resources, that's funding, and we also look to inform policy and statute to put best practices in place in Michigan. You'll see at the very bottom of your screen, the MI Lead Safe Homes is our fledgling website. We're continuing to add content and grow, but we'd love for you to check us out and see what we are about. We have monthly coalition calls. Everyone is welcome to listen in. We get state updates and HUD updates on funding opportunities. We hear partner updates, and we all touch base on how we're addressing some of our policies. So moving on to our Lead Education Day, what to expect. And some folks on the call have participated with us in the past at Lead Education Day, and we have some new folks. We're really excited to welcome you. We are slotted to begin at 8 o'clock. It's really important that we get there on time. We do have folks coming in from all corners of the state, and I recognize that it is a burden, so leave early and to get here on time. But we do have a special guest speaker. The Lieutenant Governor has confirmed that he plans on stopping by and giving us a welcome and talking a little bit about lead and some of his ideas between 8:30 and 8:50. So we really want to be there and in place. When we get there first thing in the morning, if you have registered, you'll get a name badge. Everybody will get a folder, and that will have your itinerary, contact information, talking points. Our staging area is in the Farnham building. You'll get some information about how to find that and where best to park. That is going to come in an email probably later today or early tomorrow. So we're going to get started with a bang in the morning. We will reconvene as a group in our staging area where we start out. We're going to have a lunch, and Senator Curtis Hertel has committed to popping by at lunch and speaking with us. He may have some prepared marks, or he may just want to network with us and meet us in the room. He is the one that is sponsoring us in the Senate office building, and so we definitely want to thank him. We are putting the final agenda together, and when we have a break in our legislative meetings, we will have a group photo. Hopefully we'll be able to do it in the Capitol. It's really beautiful there. And I also wanted to give folks a heads up that we're going to have an online survey immediately following Lead Education Day, and this is new for us this year. We do surveys every year. We do act on the feedback that you give us, and we want to keep improving this experience and making it worthwhile. And the little bottom caption, we will have fun and we will reach policymakers. This day is a super fun day. It's a low stress day. We try to make sure that, you know, it's very impactful, that we have plenty of meetings, but no one is run ragged, no one is overwhelmed. It's just a fun day to spend time in the Capitol with our policymakers, and I want to stress that. So legislative meetings are the bread and butter. It's why we come to our Lead Education Day. We will be meeting with between 60 and 70 legislative offices, both the House and the Senate, members and staff, and we are going to help inform them about lead. We are going to go over some policy priorities for them. We're going to answer questions, and you know, it's going to be a really good day. We try to have 2 legislative meetings for each group before lunch and 2 after, so that'll give you enough time to get around. We will have teams of 4 to 5 people, so no one will be by themselves in these offices. And we will have a team leader. And please know that the team leader will either be a registered lobbyist, will be someone who's participated in Lead Education Day numerous times. These are folks that know the Capitol. They're going to be able to navigate you, get you to where the offices are, get you through security. They're going to be taking notes for the meetings. These are folks that know these lawmakers, know how to run a legislative meeting, will keep the conversation flowing. You know, they're going to do a lot of the heavy lifting for us. And so I wanted everyone to be aware of that. They're also going to be responsible for the leave behind packet for our lawmakers. So that is something to consider as you come. So at these legislative meetings, you know, the lawmakers are going to listen to us. We're going to introduce ourselves to them, but their question to us right out of the gate is going to be, what can I do for you? And what they can do for us is allow us to talk through our talking points around lead poisoning prevention. These are our 2016 policy priorities for the Michigan Alliance for Lead Safe Homes. We worked on them as a coalition for a number of months, and these we believe are best practices to end lead poisoning in Michigan. The first one is a no-brainer. It's low-hanging fruit. It's a commitment from the state to end childhood lead poisoning. This could be in the form of a resolution or otherwise. And so if we have the state commitment to end lead poisoning, the rest of these bullet points will fall right under that umbrella. Money for education, surveillance, and testing. The members that we're meeting with, we're very particular about who we're scheduling meetings with, and they are appropriation committee members. And when I say appropriations, I mean these are the lawmakers in charge of the state budget. They're currently holding hearings, and they're making decisions right now about our state tax dollars, where we should be putting them, what we should be investing in. And so we're going to be meeting with them. We're going to be talking about lead at the same time they're deciding how to spend the state dollars. And we're also meeting with health policy committee members. These are the subject matter expertise folks that will deal with lead bills. And so the more familiar our policymakers are with lead and Lead Education Day, the more likely they will be to act to do the right thing. Another policy priority will be, of course, supporting Flint families. There's a little bit more about Flint further on in the presentation, but we are very supportive of what's going on in Flint. We want to make sure that community gets the resources that they need. Making sure residential properties are lead safe before sale or rent. For those of us that own a home, you'll probably remember a lead disclosure statement that you received potentially when you were buying that home, but it's not incredibly helpful right now. Most of them say no known lead hazard, but there was not an affirmative test done. So we want to make sure families know for sure or not when they're moving into a home. And it's the same with rental properties. Rental properties should be lead safe before a family moves in. We do have families that move in and out of rental units, and there are rental units that have poisoned multiple sets of families, and that's just not acceptable in Michigan. We also want to increase abatement funding, and by abatement we mean making homes lead safe. Currently, when a child tests positive for lead, a family can apply for help making their home lead safe, and there's a wait list of families right now. So we do not have the resources to help families make their home lead safe even after a child is poisoned. We also want to make lead poisoning prevention an essential local public health service, and by that we mean we want every health department in the state to be making lead poisoning a priority. Currently, there's only a handful of local public health departments that do outreach and education and testing in their communities, and it's defaulted to the state right now. And so we want local communities to be able to do that county by county. We also want to provide nutritional educational intervention for all of the children. You know, regretfully, you know, kids who are impacted by lead, you know, we want to increase their learning potential, we want to increase their outcomes, and so we want the same kind of interventions that we're seeing in Flint with nutrition and early on and childhood education available for all of our children. And so with that, I'm going to turn it over to Bree with the Michigan Council for Maternal and Child Health, and she's going to tell us how to get the most out of our legislative meetings. Okay, well, Bree may be having a little bit of difficulty joining us, so let me start on this slide, and hopefully she will be.
Can you hear me now, Tina? Tina?
Yes, she just can't hear you. Go ahead.
Oh, can you hear me now?
Bree, you're good to go.
Okay.
Laurel and Tina just cannot hear you at this point.
Oh, okay. Spectacular. It's been a day for technical issues. Well, thank you everybody for joining us. Once again, my name is Bree Anderson. I'm going to go over some of the legislative 101 components. Some of these might seem very, very simple, and we're not trying to you know, talk down to anybody. We just want to hit it from the ground up so that we're all ready to go. So the first thing, dress professionally, which might seem silly, but in the winter in Michigan, that can be challenging to dress professionally as well as comfortably, and with shoes and so forth that you can get to and fro pretty easily with. It's slippery. We're going to be doing a lot of walking to and from the Capitol and from the other buildings. So please dress in a way that you are comfortable and that you're going to be safe in. But a step above blue jeans. You don't have to be wearing a three-piece suit and a tie or anything like that by any means, but just something that looks put together and fresh and ready to go. So that's the numero uno. The second point, which Tina addressed a little bit with going over our schedule, is that we're going to need to be flexible. Throughout the day, legislators they'll be in session, they'll be going to committees and so forth, where we might have a scheduled meeting, but that doesn't mean that we'll actually get the legislator there. We might potentially be meeting with their staff, which is not a bad thing. Often staffers are the people writing legislation and doing a lot of behind the scenes work. So that can be perfectly great, if not sometimes better. So just be prepared for that. It's not a slight to you. It's just when things are getting really crazy during budget season, we might not be able to meet with the specific legislators. And to that point, if we do, we might have to hurry up and get to our point swiftly, and or if we have a little bit more time and they can speak with us, we can take our time. Just depends on what's going on. Moving on, speaking from experience, the reason that we're having all of you come specifically is that you're the ones in the field who actually have the experience with this. You know, when myself or other lobbyists go in, these legislators are familiar with our faces, they know our story. They want to hear from you and your experiences in the field, particularly around lead abatement and how people are impacted back in their district, which goes to the second point of making the local connection. As with anybody, it makes much more of an impact if you can tie it to their own lives, or in this regard, their district. So if we, and I'm sure Tina and everybody will have lined up those who are from their specific districts, but anytime that you can tie it back to their place of origin, where it makes them think about their constituents and their friends and family, that's going to make a bigger impact and something that they're going to take home with them. There might be a lot more questions than we've had in previous years. Lead is definitely on the forefront of people's minds. If we don't have the answer, it's really okay to say, you know what, I'm not quite sure, let me get back with you on that. Because we don't want to guess. There's nothing worse for a lot of reasons. We don't want legislators going out and using incorrect information or pieces of information. So we want them to have all of the correct information. And it affords a follow-up time that you can go back and say, hey, thank you so much for meeting with us. Here's that piece of information we wanted to follow up and get you that other point that you needed. So it's a twofold, it's a win. If you don't know the answer, just say, we'll get back to you, or let's talk some more about that and get some specifics. To that point, being clear and concise. Sometimes when we get really passionate about our issue that we're knowledgeable about, we can have a tendency to, at least myself, go on and on. We need to be firmly knowledgeable what, how much time they have, the time constraints that are put into place, as well as get to our points. The talking points that were listed on the previous page are great for that. And have a specific ask, which we do. If nothing else, they're going to say, so what do you want from us? Well, we want to raise the abatement budget from 1.75 up to 6.75. So you can give them something to take home either to their legislator or to their constituents to think about. We're also going to leave materials and contact information for follow-up. There's nothing worse than if they're in committee and go, I remember I had so-and-so in my office, let me get back to them, and they don't have the information. So we'll have a nice packet for people to go back and do that when they need to. So that's Legislative 101.
Thank you. And Paul, do you want to take over the lead poisoning highlights?
Great, thanks for all that information, Bree. I'm going to talk a little bit about highlights, where we're at with childhood lead poisoning. We hear a lot about Flint, and there's certainly lead poisoning in that city as well, but it's important for legislators to know that there are more than 5,000 kids lead poisoned statewide every year. The last year for which we have data from the Michigan Department of Health and Human Services is 2014. And that year there were 5,049 kids lead poisoned. That places Michigan number 5 in the nation in terms of lead poisoned kids. We're in company with other Northeast, New England, and upper Midwest states in that category of 5 highest. And that is because a lot of our housing stock is very old and was painted with lead-based paint. We have a lot of wood-clad housing and built around the turn of the century and into the early 1900s, and that means a lot of houses have lead-based paint and potential for hazards. We certainly have a lot of cities with leaded plumbing service lines. So you couple those two things together and you really have opportunity for a lot of kids to be lead poisoned. Estimates show that 4 to 7 point decrease in IQ for every 10 micrograms, and that's how we measure lead, increase in blood lead. But what's really compelling about this little fact here is that it's the first doses of lead that get on board in the child's body that make the biggest impact on IQ. So the research will tell you that the impact is what they would say or call nonlinear, meaning that when kids those lower blood lead levels, the impact on IQ dose for dose is greater than as they get exposed more and more. So it's cumulative across the board, but those little bits matter. Lead can affect any and every organ in the system, but we are primarily concerned about the brain and neurological development. As we say locally here in Grand Rapids, we just simply say lead causes brain damage, and that's where we like to start with folks. If they want to talk about it affecting other parts of the body, certainly that's the case. Certainly there's truth to that. But our primary concern, at least here in Grand Rapids and maybe across the state, is the impact upon brain development. And that happens to these kids at 6 years of age and younger because they're undergoing a period of rapid brain development. If you think about kids that you know when they're 8, 10 months old to a couple of years old, they are learning at a rocket pace. They're learning to walk and crawl, they're learning to jump, they're learning to talk, they're learning their colors, they're learning all kinds of things. And it's that rapid brain development that lead interferes with. And it's permanent damage. So you can't go back and relearn or have a second chance at making those neurological connections. Kids can learn to get by perhaps without those connections, but they still are missing those connections. So they will have, some cognitive impairment. Whether they are successful later in life and learning to live with that will depend upon the individual child, but it's certainly not anything we want to hand a child from the get-go. So again, lead exposure can do a lot of things to a human body. Pregnant women, as the picture shows here, are potentially or particularly susceptible as well because they pass the lead right from their blood across the placental barrier to the young unborn child. So we want to make sure that pregnant women are not exposed while they're pregnant. And if they were exposed as children, sometimes they will store the lead in their bodies, particularly in their bones. And when they get pregnant, pregnant moms are often recommended that they increase the intake of calcium. And so that's really important for bone health, but it's also important to keep the lead that may be in their bodies from leaching out of their bones into their blood system and into that unborn child. And then, this is one that's particularly impactful for me. A teen exposed to lead as a child, that's where we really start to see the impacts of lead is when kids get a little bit further on in school. We don't see, as my friend Joan Dyer says, we don't see spots on them when they're 1 and 2 years old, so we really don't notice the effects of lead at that age. But as they get older, they start to perform more poorly on standardized testing. We notice the decrement in IQ, and we start to see potential behavioral issues. So hyperactivity, attention-related issues, and impulse control. And it leads to things like truancy, dropping out of high school, committing criminal offenses, and then other issues of poor judgment that might affect a child later on in life. Next slide. Can we get the next slide? Thank you. And then, so what happens when a child is lead poisoned? Typically, a child is going to be screened hopefully at their well-child visit, or when they go to see a pediatrician at 1 and 2 years of age and perhaps later. But many children in our state of Michigan are also being screened when they go to a WIC visit or engage with local public health. So it's important for you to know that when we talk about screening in the state of Michigan, what we are talking about is the child is asked a set of questions. There's no medical procedure at that time. They are asked a set of questions to determine their potential risk. That is the screening, and that screening is comprised of really 3 parts. The first part is that does the child live in a high-risk community? And the state of Michigan has identified about a dozen high-risk communities. They're mostly your larger urban centers in the south part of the state, so Detroit, Grand Rapids, Kalamazoo, Lansing, Battle Creek. If a child lives in one of those communities, they screen in for a lead test. We don't have to ask any more questions. They should be tested. So in those cities, we should have universal testing of all 1 and 2-year-olds. The second question is the child on Medicaid or WIC? If they are on Medicaid or WIC, they should be tested. Doesn't matter if they live in a high-risk city. Doesn't matter if they answer yes to any other questions. If they are on Medicaid or WIC, they should also be tested at 1 and 2 years of age. And then lastly, there's a third set of questions that get at, do they live in older housing, are they refugees, and so on. So many of us are coming from the urban communities in southern Michigan, and we should see 100% testing of 1 and 2-year-olds each year in those communities. What we are seeing currently in the best communities, we might be approaching 55–60% of kids being tested at 1 and 2 years of age. In many communities, it's less than half. So we have a real need to get lead testing up in the state of Michigan. Then if a child has a lead level reading of 5 micrograms per deciliter, and that's how we measure lead, those lead results are reported to the state. Actually, all lead results are reported to the state by the lab, by the person doing the lead test. The state then transfers and alerts local public health for kids that have a lead 5 and above. Those families then get notified. Hopefully the pediatrician's on it and gets to them right away. Certainly then if they have a child with a level of 5 or greater, local public health should be connecting with them. In the counties where local public health is not making the connection, the state is attempting to make those connections, but that's still kind of in development now as we've moved to this lower level. In the cases of kids that have higher levels, and this varies county by county, oftentimes they will be offered a lead inspection or risk assessment to look at the environment and find out where that lead is coming from. We refer to this as an environmental visit. I know in our county, Kent County, Grand Rapids, that is triggered by a child with a blood lead level of 20 or higher, so significantly higher. And sometimes if a child has a persistent level above 15, they will initiate. So not all children are getting that environmental assessment. And so that's a weakness here, because it would be wonderful to be able to offer that to all children that have been exposed. Eligible families can apply for abatement assistance, and that again varies by the local communities. The state does have a program. That's one of the pieces we'll be talking about. But in your local community, it may also be federal funding, and those funds are extremely competitive, so not all communities have those funds. I believe currently in Michigan, only Muskegon and Detroit have funds, or it's either Detroit or Wayne County have funds. But that's it. Across the rest of the state, we're relying upon what the state puts into lead abatement. Those homes are then made lead safe, ideally, and the child is monitored to make sure that their lead levels decline over time. And it does take time for that child's lead level to decline, particularly if there's not been an environmental intervention. There are follow-up services, and these again really vary county by county. Some counties offer more, some less, depends on your local school district in terms of how they're going to track the child once they're in, and it also depends upon the parent's willingness to have lead noted in the child's individual educational plan. So that is going to vary county by county, but we're working on building an infrastructure that's stronger, and that's a lot of what's happening in Flint today. Is that we're really pushing for those kids that were exposed to have really good follow-up care, and that's extremely important. And that is an example of a key lesson that unfortunately we're learning out of tragedy, but we're learning nonetheless, and we can apply across the state. Lastly, not all kids who should be tested are tested for lead. And these are all the cracks that the kids are falling through. Many families can't afford a lead inspection if they can't get one from local public health. Again, in Grand Rapids, we do environmental assessments for less than 5% of the kids that are exposed. So if families can't afford to do that on the private market, it costs a lot of money to them. They don't have the money to make the home lead safe, or maybe they don't qualify for some reason. And so families are clearly falling through the gaps, and that's why we still see 5,000 kids lead poisoned every year.
Okay, Bree, do you want to talk a little bit about Flint?
Yes. Can everybody hear me? Or, well, we're just going to assume that all is well. So, as the slide says, Flint is the elephant in the room. In previous years, when we've gone into offices, most legislators and staffers have just sort of looked at us with blank stares and said, oh, I didn't even know lead was a problem. I thought we had taken care of that when we got rid of it out of paint and gasoline in the 70s. So the positive is that people are aware of lead. They're very aware of lead. The negative is a lot of the focus exclusively is going to be on Flint. We need to anticipate what questions people are going to have. Most of the legislators and staffers are going to be viewing lead exclusively through the lenses of Flint and water-based poisoning. But we need to acknowledge that and say, absolutely, all of these think the number is 10,000 kids in Flint we have to assume have been poisoned. The state is going to be treating them as such and going to be offering long-term programs and everything, treating all of these kids as though they have been. Our stance is that no child should ever be lead poisoned by anybody. We shouldn't be using children as lead detectors. That's not the way that we believe Michigan should be operating. Flint is a teachable moment and has galvanized the state and received national attention, which for our purposes is a good starting point to say all of these children are going to be impacted for the rest of their lives, but we also have children all over the state who have the same challenges, who are not receiving the funding, the abatement services, and everything else that they need to be as successful as they can be. So we look at Flint, we need to look beyond the quick fixes to structural and systemic solutions that work to protect and serve children statewide. This is going to be a years-long, ongoing component to pretty much every state budget for the next 10 years minimally that we can see. And that's okay. This is what needs to happen. So as we go in, we can't minimize Flint and say, well, only a small percentage of lead poisoning occurs through water. This was a huge percentage in Flint. So we need to discuss how this is what happened in Flint, but how does it happen throughout the rest of the state, and how does that look similar, and how does that look different? So now is the time to finish the job and end lead poisoning throughout all of Michigan. It's a great opportunity to get people to understand and really stand up and listen to what we need to make our kids healthy and safe. All right, I think we're ready for the next slide. All right, so to this point, the whole reason that we're doing this, your voice does make a huge difference. Legislators want to hear not from reporters or from lobbyists. They want to hear from the people in the districts and the people in the field who are actually doing the work. The take-home message is lead poisoning is preventable. This is one of the few things in public health where we actually have solutions and can say, no, this is 100% preventable. This does not have to happen. It's solvable. We have the solutions. Look to us. Let us give you the solutions and the methodologies on how to fix this. Prevention is the only solution for our kids. As Paul said, there's no going back. Once a child has been affected by lead, their brain is damaged, and we cannot fix that. We can only mitigate and try and do the best we can with nutritional and other resources. Lawmakers need to hear from you, all of you, about how they can make these changes to impact the kids that we have now, as well as all the future kids who are going to be in all of these houses and all of these communities throughout the state. I'll turn it back over to Tina.
Okay, that sounds good. Thank you so much for all that wonderful information. This is the question and answer period. We haven't received any questions, so if you do have a question for us, please use your type prompt and type in a question for us. If we don't get questions, we can assume we covered everything in this webinar and did a great and wonderful job. But while we're waiting for questions to come in, I want to spend a minute to talk about the packets that folks are going to get when they do come to Lead Education Day. In the packets, you are, again, teams are going to be 4 to 5 people, so each team is going to have their individual schedule, so that way we can cover and meet with more legislative offices. And so with your individual schedule, you will be getting legislative bios, and Bree talked about making a connection with the district, and so those legislative bios will tell you a little bit about the legislator you're meeting with, will show you where on the map the district is. In all likelihood, you may have a constituent or 2 in your group of that member, and it's going to be really important to highlight that you do have someone that has traveled from the district to meet them. And also the legislative bio is going to talk a little bit about the legislator's past history. Were they an accountant? Were they a school teacher? Were they a Kiwanis member? And that may jog your memory. You may have some connection either with alma mater or something. Please use those connections in your legislative meetings. And as Bree said, I want to make very clear that if we don't know the answer, write down the questions, and the team leader will get that information to us, and we will definitely follow back with the legislators There has not been one legislative hearing here in Lansing about Flint or about lead poisoning, and so members' offices may have some either basic questions or technical questions that, depending on the members of your group, we may or may not be able to answer. So, please know that that could happen. There is nothing, wrong with letting them know that we will get back with them. So I still am not seeing any questions, and being respectful of everyone's time, the next slide has my contact information. So if you think of a question or have a concern before Lead Education Day or after, please reach out to me. I can connect you with other coalition members if it's a question I can't answer. Please also anticipate, again, either by this afternoon or early tomorrow morning, if you've RSVP'd, I will be sending out a schedule of the day, including parking instructions, and make it so you're able to come into town, and then we'll get going from there. So thank you so much for participating today. Thank you for our presenters, and I look forward to meeting and seeing most of you next week. Goodbye.